A toxic study of 4R cembratriene-4 in subcutaneously exposed Sprague rats. This is a collaborative study between the Department of Neuroscience at the Universidad Central del Caribe, Puerto Rico, Department of Biology at Westchester University, Pennsylvania, and Neuroprotection for Life at Indiana. The neuroprotective property of 4R and to less extent of other sembranoids was extensively studied by our group using ex vivo and in vivo methods. 4R protects ex vivo hippocampal slices against the NMDA-induced excitotoxicity by a nicotinic receptor-mediated mechanism. 4R ameliorated the oxygen-glucose deprivation-induced damage in the rat ex vivo hippocampal slices. Moreover, 4R was neuroprotective against neurotoxic organophosphate inhibitors of acetylcholinesterase such as paroxone and the surrogate of sarin, GFP. The benefit of the ex vivo hippocampal slice model is that it predicted the efficacy of 4R neuroprotective activity in vivo. We found that 4R decreased neurodegeneration after a stroke caused by middle cerebral artery occlusion. Rodents injected intracranially with 6-hydroxydopamine developed Parkinson's disease, but a repeated injection of 4R eliminates the behavioral, histological, and biochemical expression of this experimental Parkinson's disease. Administration of 4R to rats 1 hour prior to treatment with GFP or 24 hours after treatment with GFP significantly reduced the neuronal death and inflammatory responses in the hippocampal CA1 region. A major obstacle for development of drugs expected to target the brain is that few cross the blood-brain barrier. 4R not only crosses the blood-brain barrier, but reaches a higher concentration in the brain than in plasma, suggesting that it is accurately transported into the brain. One of the main possible therapeutic targets of 4R is against neurotoxicants like organophosphates. Organophosphates have widely used civilian application in industry and agriculture despite their neurotoxicity. Organophosphates that irreversibly inhibit the acetylcholinesterase were used in warfare and terroristic attacks. Acute poisoning with acetylcholinesterase inhibitors generally associates for neurological damage caused by the synaptic accumulation of acetylcholine and the subsequent cholinergic crisis. While the classic antidotes have proven to be effective in decreasing mortality, they do not target the delayed neurotoxicity associated with brain damage, inflammation, and apoptosis. Thus, it is evident that a neuroprotective antidote capable of ameliorating neurodegenerative processes is needed. This toxicological study of 4R represents the first step towards its clinical evaluation for drug development. Here we report the toxicity and the maximum tolerated dose in male and female Sprague rats after a single subcutaneous injection. Male and female rats were injected with single subcutaneous dose administrating 0, 6, 24, and 98 mg per kilogram on day 1, followed by a 7-day observation. A 7-day observation period reflects the intended use of the therapeutic as a once-in-a-lifetime antidote against acetylcholinesterase inhibitor poisoning. Body weights and clinical pathology such as hematology and chemistry were collected on day 3 and 8 prior to euthanasia and necropsy. Gross observations were documented and microscopic evaluation were performed. All animals survived to their scheduled necropsy on day 8. No apparent body weight changes related to the administration of 4R were observed for any of the different dose groups. The hematological profile revealed changes in subjects injected with 4R. On day 3, the mean platelet volume was slightly but significantly increased with 10% for the 6 mg per kilogram males and 24 mg per kilogram females compared to the controls. On day 8, the percent neutrophil count was increased by 44% for the mid-dose males. However, this can be attributed to the outlying result for a male subject, and it is not considered to be toxicologically relevant. There was a significant decrease in mean absolute eosinophils for the low and high dose females, 53 and 58% respectively. However, this effect resolved by day 8. The rest of the analyzed hematological parameters did not have significant changes after the application of 4R, even at its higher concentration of 98 mg per kilogram. The mean albumin values were slightly decreased with 11% for the high-dose males, but this parameter went back to normal by day 8. On day 8, blood urea nitrogen and creatinine decreased in males with 25% in the middle dose and with 35% in the high dose respectively. The rest of the analyzed serum blood chemistry markers did not have significant changes after the application of 4R. 4R did not affect the activity of the liver enzymes aspartate aminotransferase, alanine aminotransferase, and alkaline phosphatase. The absence of alterations of hepatic enzymes supported the notion that 4R is not hepatotoxic. The most prominent changes were present at the injection site. There was considerable overlap in the lesions present at this site between vehicle control rats and test compound treated rats. However, in both males and females, the injected sites in test compound treated rats had more severe and frequent ulceration and to a lesser extent more severe or frequent inflammatory and necrotic changes than gender-matched vehicle control rats. In summary, all animals survived until the last day of observation. The results show an apparent adverse effect of the subcutaneous injection of the vehicle, and its unwanted effect was further increased when 4R was administered dissolved in the vehicle. The mean platelet volume (MPV) increase observed in female treated with 6 and 24 mg per kilogram could be considered as a potential risk factor for stroke occurrence and a bad prognosis for stroke outcome. However, the MPV increase reversed by day 8, where the low-dose females had a mean 10% decrease in MPV, suggesting that this finding, although noteworthy, was not critical. Blood chemistry showed in males treated with 4R a significant decrease in creatinine, blood urea nitrogen, and to a lesser extent albumin. This decrease could be due to the reduced food ingestion or to severe hepatotoxicity. Both factors can be ruled out because there was no observed decrease in body weight and the levels of liver enzymes did not show signs of hepatotoxicity. In conclusion, the 4R cembratriene does not appear to be toxic even at the high dose of 98 mg per kilogram.